Hello, and welcome to the In-Network podcast feature, Designing for Health. I'm Nordic's Chief Medical Officer, Dr. Craig Joseph. In this episode of Designing for Health, I sit down with Stacie Stoner, Chief Growth Officer at CareTalk Health, to explore a deceptively simple question. Why is healthcare still so much more complicated than it needs to be? Drawing on her lessons from American Express and consumer experience design, Stacie explains how her team has built virtual care workflows that reduce friction for both patients and clinicians. We discuss patient engagement, care gap closure, telehealth adoption among Medicare beneficiaries, and why concierge service shouldn't be considered a luxury. It should be the baseline expectation. For healthcare leaders and physician executives, this conversation offers practical insights into consumer-centered care, virtual care operations, and the often overlooked connection between experience design, clinical outcomes, and workforce sustainability. Let's plug in. Stacie Stoner, welcome to the podcast. Where do we find you today?
I'm in San Antonio, Texas today.
All right. And are you over the Spurs loss? That's the question.
I am not over the Spurs loss yet, but it's a nice young team, and I know that we're going to have a great season next season too.
Okay. So if someone's listening to this podcast in 2028, it won't make as much sense to them. But when we're recording this, it makes a lot of sense.
That's right.
So why don't you give us a little bit of your background? Right now, I know that you're at CareTalk Health, and we're going to talk a little bit about that. But tell us how you got to where you are now. Is this something you thought about when you were in kindergarten? That's really what I want to know.
I can't say that it is. When I was in kindergarten, I think I wanted to be a meteorologist. Growing up in Kansas and, living through tornado season after season, I thought, well, I really want to do that job. That's not where life took me. I got very interested in the people business, really as I got into college, and I started my young career working with political campaigns. And that kind of morphed into things like consumer engagement, and then consumer engagement or patient engagement in healthcare. And that's what brought me to where I'm at today. But it's, I've always enjoyed the design of messaging and getting people to take action, delivering calls to action to different cohorts of people.
When we were preparing for this episode, you told me that you used to work at American Express,
yes.
which kind of piqued my interest there a little bit, because I just remember, like, you're not a card holder, you're a member. There were commercials about that, and that the user experience was key. Can you tell us a little bit about, like, what were some of the things that you were working on, or that American Express was doing that are different than some of its competitors back in the day?
Well, the thing about American Express, the thing that was just absolutely, drilled into us as stakeholders of the business, is that card member experience was the business. Every touch point builds trust or it erodes trust. And as I spent time at American Express and then transitioned into healthcare, the thing that I learned is that in healthcare, the patient, at least at that time, didn't ever seem to be at center stage of design. Friction wasn't necessarily looked at as a problem to solve. And so, I thought back to my time at American Express, and then when I went into the healthcare arena, I think it was indeed that experience that I was able to bring value to the organization that I was working with, because card member was so at the center of everything that we did. That was the measure. So as I thought of, my own scorecard, not only was I measured on financial impact to the shareholders of the organization, but also what were card members saying. So we looked at things like Net Promoter Score, customer satisfaction, and those were weighted as heavily as any type of financial outcome that was a goal or an expectation. I then wanted to bring that and apply that into my role in healthcare, where, no matter who the constituent was, whether it was our patient or our employees or our clients, making sure that we use that net promoter, as an example, as the bellwether of whether or not we were successful.
Yeah, so it's not the number of patients you can see or the number of procedures you've done. Those are important. Clearly, the patient experience, the consumer experience is at the height. And I love it when folks kind of learn that in a non-healthcare setting and then bring their experiences to healthcare, because we tend to be a little insular in healthcare. I know you probably never experienced that. We think if you didn't start in healthcare often that you can't really bring anything important to the game. And certainly we're learning the lessons, although slowly, but we are getting better at kind of taking in those outside experiences and bringing them together in healthcare to make it all better.
I think even in my organization today with CareTalk Health, that at one point, you might look at it from if you're insular in healthcare as a liability, we certainly have, chief medical officer, clinical leadership within the organization. But many of us come from outside of healthcare. We don't consider that to be a liability. We consider that to be an asset. So long as the ethos remains focused on the patient experience, and then the health outcomes that are derived from the interaction our clinical team has with patients, we think we're doing the right thing.
Yeah. Well, so tell us, what is it that you're doing? Tell us more about CareTalk Health.
Well, maybe just a little bit about our origin story. So, our original bet was taking chronic care management directly to the healthcare consumer, so to the patient. And we learned a couple of hard lessons with that early on. Direct-to-consumer acquisition is expensive, brutally so. And also, chronic care management really isn't something that you can convey the value of in a 10-second or a 30-second spot when you're trying to have consumers engage with you. But while the model was wrong, what we found is the capability and what we had built was right. So what CareTalk Health had built and has built is a nationwide network of providers and clinicians where we can deliver virtual care at scale. So we had that infrastructure built. And so the pivot to us became, who can we partner with? Who should we be looking to partner with who has members, has patients who have needs? And those needs may be completing an annual wellness visit. And alongside that, with many of our partners, addressing gaps in care that the member patient may have. We have our virtual network that is able to help address those challenges and get care to people who may have great difficulty getting into a provider's office, whether that's because of distance, access, time. That's the space that we serve today. We very proudly serve today.
And so it sounds like you've kind of recreated the physical experience that one gets only on, going to see their primary care doctor or going to see a physician, but you've done it virtually. So kind of walk us through a little bit about, if we're a patient or a user of yours, how does that work? What do I do, and how does it feel different or the same as checking into a physical office?
We have been deeply intentional about the type of experience we want to create for patients with a virtual visit. When you consider that, we're talking with primarily a senior population, because many of our patients are Medicare patients. Creating an intentionally familiar experience to help, alleviate any apprehension, build trust was something that was really important to us. So what we've done is mirrored an in-clinic, physical, I go down to my provider, my PCP's office down on the corner. We've mirrored that experience nearly step by step, but in the virtual environment. So a patient is checked in by a patient support specialist. So we make sure that we're meeting with the right patient. We then have that patient placed in a private virtual examination room, and we bring the care team to the patient. First, the nurse, much like when you go into an on-prem clinic, is going to come in, check your vitals, talk with you about things that might be going on, talk about your medications, and then a provider comes into that private room and does an examination. We've replicated the same thing in a virtual environment. And, we are hearing from patients that, you can almost see them physically relax in the visits that they're having because I've scheduled this visit. I'm not really sure what to expect, even though, maybe I've done a telephonic or a telehealth visit before. I haven't necessarily done an annual wellness visit that way. That familiarity of experience, you can not only see it, but you can hear it. And our patients tell us often, wow, this was easy. Because what we found is when the structure feels familiar, the tech stops being the story, the virtual aspect stops being the story, care becomes the story, the outcomes become the story.
This conversation kind of reminds me of when Apple first started, Apple Computer. One of the things that they did that was a differentiator was to make things kind of look familiar on the computer. Mm-hmm. So I think the term is skeuomorphism, where, if you're expecting to look in a calendar, there's something on your screen that looks like a calendar. And there was something on your screen that looks like an address book. And after decades, we've kind of moved away from some of that because a telephone, with a little handset doesn't mean a lot to Gen Z. They don't really know what that is, but I do think it makes a lot of sense at the beginning, especially with certain, with senior citizens, maybe making it much more like, hey, this is how it's been for the last 40 years and you're comfortable with that infrastructure. And maybe that'll change in 10 or 20 years. But right now that seems like it does make a lot of sense. And it sounds like you're getting the feedback that it does.
We are indeed. Things as simple maybe to you and to me as getting into a video visit for some of our patients doesn't seem so simple, but that's one place where we have made that exceedingly easy to do. But we've also we really do guide the patient along every step of the way. We stay connected with the patient in an audio way via phone and are able to walk them through. Now press this button, please enter your name. And then magically our faces appear on screen together. You can see me and I can see you. And so seniors certainly are not a monolith of not tech enabled, not tech savvy, but tends to skew that way a bit. We've taken some of that anxiety out of that piece of the process as well, because of course we're best served to facilitate telehealth visits, being able to see the patient face to face or near face to face through the technology.
And so it sounds like you've kind of you've tried to make this a designed, maybe frictionless, or at least minimize the friction. And one example you just gave was, hey, we start this off as a telephone call, maybe before we get to, and on the phone, which everyone's comfortable with, we will guide you through what you're supposed to click and answer any questions if you need those. Are there other kinds of frictions that you've seen with your patients or consumers that you've been able to identify and then simplify or make go away?
The virtual clinic design that we have today really was the unlock for us to remove friction from the patient experience. But we actually even had several iterations of that virtual clinic design. I think back, it's kind of amusing to me now looking back a few years where we started. So where we started is we would, of course, have a scheduled appointment for a patient, and we would have our provider do the first outreach to the patient and get them on the phone. And, that worked very effectively at the time. But as we continued to grow and scale our business, it just seemed to us like, providers not only perhaps don't enjoy that part of the job so much, consumer outreach, patient outreach really isn't their thing. They're also not really working at the top of their license. So, we had a real, the path that we were able to find was really bi-directional with the virtual clinic design as it is today, where, we're shepherding the patient through the familiar process. And the bi-directional unlock was that not only is it a better patient experience now and that familiar experience that has demystified virtual care to some degree, but the other unlock was for our own team, where we were able to have providers see more patients because they're no longer dialing. to get the patient on the phone.
Sure. Yeah.
You're able to focus more on the care of the patient instead of thinking about, I have another patient to call here in 5 or 10 minutes. So I think that, and hopefully I've answered your question. I may have gotten a little bit off track there, but that really has been the biggest unlock for us with the virtual clinic and with the design.
Yeah, I love the idea that it's not just that, hand holding, we can kind of say, oh yes, the patient needs hand holding. This is sometimes complicated. But your physicians need hand holding too. And having them, it makes a lot of sense to me to have, to ask your senior clinical folks to work at the top of their license.
Right.
One question I always ask when I'm working on the hospital side and someone wants to get a physician to do something with technology or with anything, actually, my first question is, well, did you need to go to medical school to do that? And whatever that is that we're talking, right? Did you need to go to medical school to ask the patient what pharmacy they're using? And I'm pretty confident the answer is no, you don't need to do that. And so we shouldn't ask the doctor to enter that information, even though it's often convenient and simpler and more straightforward during certain workflows. So that makes complete sense. And I think when you've either been in it or watched an office function, a well functioning office, I guess, function, you often see like the medical assistants and the nurses are kind of hand holding for the doctor. Like, you need to go into 3. And I've been on the receiving end of this conversation. I need you to go into room 3 and I need you not to spend too much time talking to the mom because I'm a pediatrician. So there's usually a parent there with me. And because, the nurse knows that, I tend to talk a lot sometimes. And there are certain patients or parents who are going to get that out of me. And so kind of being proactive, like, hey, you're running late. This needs to be a just the facts, ma'am conversation and get going. Right. And those are those little things that often on technology we forget, especially when you don't have a team or when you're asking the doctor to do all of these other non-functions that they can easily do, but doesn't bring them value or joy. And
Right.
kind of get to lead you to burnout sometimes. So yeah, that makes complete sense.
Well, and maybe you've kind of hit upon something that I want to elaborate on. So, as we talk about satisfaction, patient satisfaction, and promotion of what we do, you're talking about the provider's aspect of it as well. And we do indeed hear that from our provider community to say, I like working with CareTalk Health because, and they don't say it in this many words, because you've removed the friction from my workflow. It is a familiar, what we've built with our virtual clinic is a familiar experience to them as well. They are, many of them come out of, private practice, maybe they're doing this as working with us as part of a, call it, side gig.
Mm-hmm.
But they're used to having maybe creature comforts is the wrong term, but it's the one that comes to mind of, I have a nurse that I'm working with who is talking with the patient and giving me the report, the download, if you will, before I go into the room. We do the same thing in our virtual clinic model. We have the technology underpinning that supports communication and it supports the documentation that's not only required and compliant, but also that communication between the care team that also leads to a better patient experience, a smoother experience. That the last thing you want in the virtual environment is the patient to think, are you all talking to one another? I just talked with the nurse. Is she or he talking with you, provider? We've alleviated that with the technology and the tools that we have. But again, just back to my original point here, the providers are also finding this a very gratifying environment to work in because it's familiar to them as well.
Yeah, and especially if you're working as a team, right? Not as two individuals kind of doing two separate parallel tracks, but when you have one solid goal that you're both working towards, it does make it a lot easier. Again, kind of going back to my practice, I had a medical assistant I worked with who had been working in pediatrics longer than I had, for sure. I used to joke, and this was back in the paper days, but I would sometimes walk into a room and on the paper chart, there would be paper clipped a handout for croup. And that we would give to parents if their child had croup. And I would walk in and I'm like, well, Cheryl has diagnosed your child with croup. And I know this not because she talked to me, but because there's a croup handout here. And then I would further joke, because I'm a joking kind of guy. I will, double check to make sure that Cheryl's right, and I will examine this child. But let me tell you, she's not always right. She's only right like 99% of the time. So I'll double check. But if this was a kind of a thing that you got to, once you got to know people, that she knew that if she was confident in the diagnosis, it would just make it easier for me. I don't have to go looking for the croup handout. It's already there. And sometimes you can do those things with technology. Certainly some EHRs try to do that. But I think when we try to get to too much technology where it second guesses everything and takes away, hey, you don't need a medical assistant or a nurse anymore. You're losing a lot of the fun aspects and I think this is where how you get to kind of burnout to some extent. We blame the electronic health record, and it certainly is due for a lot of blame. But sometimes it's the way you use the technology. And if your goal is just to make everything a little smoother and remove friction where it makes sense to remove friction, that's a good thing. And you want to kind of go in that direction.
I agree. I think the thing we all have to be watchful of with technology is it replacing critical thinking and also replacing just natural curiosity, enthusiasm, empathy, interaction with people. It should be technology as a tool in our arsenal of tools, but it shouldn't replace. It should make those handoffs that you were describing with the croup handoff. It's an invisible handoff, and that's really how we should look at and embrace technology today. Is don't let that replace critical thinking and just the natural cadence of speaking with a patient.
Yeah, it's the large language models, and AI is supposed to be very good at. Well, it is very good at pattern recognition.
Yes.
So are humans, right? And so,
yes.
It's one of those things where when you try to get away, you try to make everything a science. You do, I think, ultimately harm the experience and the outcome, because so many times you watch a nurse who works in ICU. Sometimes they just get the heebie-jeebies. And I've certainly been there where the nurse, had called for a physician to say like, something's wrong. Well, what's wrong? I'm not exactly sure, but something's wrong. He doesn't look right. And often when that happens, something bad is about to happen. And I don't think if you looked at science, you would be able to necessarily come down with exactly what was it. Maybe the coloring was off, or this patient used to be much more expressive and now is just kind of answering in short sentences. There's little things that humans pick up on that it's still hard, I think, for computers to do. And so got to keep that human experience there.
Yes.
One thing I wanted to kind of just talk about quickly maybe is the word concierge. And I bring this up because when we were first talking and kind of preparing for this, I said, oh, this kind of sounds like concierge medicine. And you were like, well, no. So tell me, like, how is this different, or what are you kind of thinking that this doesn't fit that term?
So to my way of thinking, the word concierge implies luxury, a luxury experience, when to my way of thinking, what we've created should be the expected experience. The terms that are often used alongside concierge, white glove or hand holding, whatever that may be. I believe strongly, as does our organization, that we should shepherd our patients through this process, and that should just be their expectation. Concierge is luxury. Concierge is extra. But the way I see it, again, hand-holding really is care. This is what the experience should be. The patient isn't here for, a slick experience. They just want to know that they're being looked after. And so, I see this more as an expectation and a convenience for the patient more than being a luxury experience.
I think that's fair. You're telling us we should have higher standards. That's what I'm hearing.
We should have higher standards.
This reminds me of a time. I'll just change the subject totally and say I was at a hardware store looking for a light bulb. and I was with my two sons who were young at the time, and I asked someone about I had a light bulb, and I said, "Hey, where should I go for light bulbs?" And one employee kind of just pointed me in the direction and said aisle 4, and I got to aisle 4, and I was overwhelmed with all of the decisions I was supposed to be making. And this was a point in time where we were moving from the kind of old light bulbs to the new different
Mm-hmm.
looking light bulbs, and one was in watts and one was in some other unit, and I didn't know how to kind of compare them. And a different employee came up and said, "You're having trouble?" And I said, "Yes." And he pointed me to a conversion table, and it's like, "Oh, well, this says it's a 45, and that means you need an 8 or whatever, and here are the choices." And after that, I looked at my kids. I'm like, "That's the way you want to be treated, not just point me in the direction and be off." And I think you're taking some of that and saying, "Hey, we should be doing the same thing in medicine," which I
Yes.
totally agree with. And I love that you're doing that. So talk to me a little bit about, and one of the things that kind of we talked about was care gaps.
Yes.
And a lot of your customers are big health insurance companies to some
Correct.
extent. And of course, we understand why they want care gaps to be closed. And again, a care gap is, oh, you should have gotten this vaccine, or you should have had a colonoscopy. And it doesn't look like you've had that because no one has billed us for that. And we want you to have those tests because we know that it's much better to find out about a cancer diagnosis early when it's really treatable than when it's 5 or 10 years later and you're having symptoms, and it's much more complicated. And so how do you change how a healthcare or an insurance company normally would deal with closing care gaps? What's the before your company and after your company?
Glad that you asked that question. So, you described, I think, the quote before pretty well. I'll take this from the perspective actually of a provider as well. So, as a provider, I have patients come in, and I do an annual wellness visit with the patient, which also includes talking about, it's a preventative visit. And so I talk about, have you had immunizations? Have you had this booster? How long has it been since you had a colonoscopy or a mammogram? Things like that. And as you leave, I may write orders for those screenings, those tests, whatever that may be. And then, that's really the extent of it. Right now, as a patient, I have an order that's been sitting on my desk for 3 months to go have a screening done. I haven't done it, and I haven't heard from my provider's office about that. That's the typical experience. From the plan perspective, the plan knows via claims data, things like that, Stacie needs to go have a mammogram. The traditional way of trying to engage Stacie to take that action is through, perhaps it's messaging through, it may even be an SMS text message or emails where I log into the member portal to look at my EOB and I see messaging to take these different actions. But it's pretty passive engagement with my members to get them to take that action. And then as you get to the end of the year, that action becomes more, the plans are more assertive in that action, and that they may be doing some targeted outreach using partners like CareTalk Health to speak to the member to compel them to take the action and have a two-way communication with them, and then schedule that appointment. And oftentimes that appointment is scheduled with the provider, and then you cross your fingers and hope that member patient shows up for that appointment. With our virtual clinic solution, and what we're doing on behalf of our health plan partners today, is not only is the member patient, sorry, I'm kind of using those interchangeably, not only is the member patient engaged and is that appointment scheduled, but because that appointment is scheduled with CareTalk Health and we're able to conduct that visit virtually, we can then give the patient those orders for screenings, those orders for tests. And with our care team, we then are following up to help them navigate that care. And so how that happens today is, once the provider speaks with patient Stacie and says, it's been several years since you had a mammogram, these screenings are really important, and that provider does that health education with the patient. The provider then says, I'm going to go ahead and have one of the nurses come back into this virtual room, and we're going to help you get that appointment scheduled for that mammogram. So again, going back to that hand-holding experience, so again, I don't want to say it's a concierge experience. It really just is a help shepherding the patient through the process.
Sure.
The nurse will come back in, and we will actually not only write the order, but at the time of as the appointment is wrapping up, we will help that member patient schedule that screening. If they don't know where to go, we can help them navigate to an in-network with their plan, an in-network facility. And then, of course, we do the follow-up from that. We want to get the results back from that screening or that test. We're going to communicate that to the patient. And if there's any additional follow-up that should be taken by the patient, we're going to help navigate that as well. So that is a very different approach than, what I'd say is the more traditional, hey, please get this done. You should get it done. It's really important. And then maybe we can get you to schedule that appointment and hope that you show up for that appointment. But beyond that, there may be no follow through with what we're doing today and how we're engaging with patients. We're seeing that all the way through and closing that loop back around to say what were the results and what is the next action, if any, that the patient should be taking.
And I think that's where it often kind of falls down is, did you get this? Did you get the study? Did you get the result? And are there any next steps? Because often there are, right?
That's
and
right.
if you don't do the next steps, you're not getting any of the benefit of the prevention that we're trying to address. Well, I love it. We could talk more, but we are running short on time. So I want to ask you the question that we always ask at the end of Designing for Health episode. What is something in your life that's so well designed, it brings you joy whenever you use it? Sometimes that's inside healthcare. Often it's outside healthcare. What do you think?
I've thought a lot about this, and this is outside of healthcare. So my espresso machine brings me great joy, typically at least twice a day, if not 3 times a day. And I am no coffee snob. I've graduated beyond the pod, and brew to, grinding my beans, tamping them down, and then, getting my espresso made from that. But the machine that I have has that all integrated within it. So I just pour my beans in. The machine tells me how to calibrate my grind. It grinds the beans. It has a built-in tamper, so I don't have to pull it out, tamp it down. I'm sure coffee people are probably like, okay, this is like a level 1. But for me, this is like a life-changing machine, and the design of that machine makes me happy every time I use it.
I love
And
it.
of course, the product that comes from it is mother's milk. So
Yeah. Well, you're not. I'm with you. I'm not as advanced as you. And so, if there are any listeners that are looking down on you, they're really looking down on me because I still have those pod thingies. But I love the idea that you've kind of found the sweet spot between the pod or just going to Starbucks and this very complicated concoction of, you have to do this and you have to do that. You're at the kind of sweet spot where you do some of the work, but the machine does a lot of it, and it gets you where you want to go at the same time as not making it too much effort.
Indeed.
It doesn't remove all the friction, but it removes some of the friction.
I still end up with ground coffee messes occasionally, but it's pretty well contained.
I love it. Well, Stacie, thank you so much. I thought this was an interesting conversation. I do want to tell you to make sure to get all of your preventative care. Close all of your care gaps, Stacie. I'm talking.
I will.
I'm talking to you.
I will address my own health as well. Thank you.
All right. That's what I'm looking for. Thanks for tuning in. We hope you enjoyed today's episode. For more on Stacie Stoner, follow her on LinkedIn or at CareTalkHealth.com. Check back for more episodes of Designing for Health wherever you listen to podcasts or at NordicGlobal.com. We'll see you again next time on Designing for Health. If you enjoyed this episode, please leave us a 5-star rating and a review. This helps others find the podcast as well.